Nurse Addie, what's the status of this patient?
Unstable. They're losing a lot of blood. On top of the wounds sustained from the accident, they have underlying health conditions that aren't making it easy to stabilize them. They've been through a lot tonight, and it isn't going to end here by the looks of it.
I understand. I'll make sure to do all I can. Luck is on their side tonight. For once in a very long time, my schedule is free.
Dr. Modelle, are you sure you want to take on this patient? At just a glance alone, they're going to take a lot of time that should have been dedicated to your day off. We can find another doctor available.
There's no time, nurse. You said so yourself that the patient is unstable and losing a lot of blood. This patient is mine.
Understood. I'll write you in as their primary doctor for their stay.
Thank you. I need their vitals and then we can... You are just a curiosity, aren't you? You turned my hospital and my staff on their heads since the moment you were brought in. That doesn't happen often. I admit that you even had me on my toes. Me, the doctor that is said to always have his 2 feet planted firmly on the ground. It's the reason I'm the head doctor after all. You're stable now. It was touch and go for a moment, but I brought you back. The rest thought the accident had taken you from this world, but I didn't give up. I have never given up on a patient, and I most certainly wasn't going to start with you. You weren't going to be the first person I lose, even as you are, bloodied and bandaged. There is a charm to you. It's a charm that draws everyone around you in. It's a charm that has everyone dropping everything just to be by your side, to help you, to heal you, to keep you safe. Even now, I'm supposed to be with other patients, but I found myself here and not wanting to leave. I found myself feeling anxious when I'm away from you for too long. Your nurses are growing tired of relaying the same information to me every hour I have asked, but I can't stand the thought of missing something. The staff are beginning to notice that I've only left the hospital a few times since your stay. Home hasn't been the comfort it used to be. It feels bigger, emptier, lonelier, unlike right here in this hospital room. This is the 3rd time they've paged me. I don't think I can ignore them much longer. I'll come visit you again. You'll be waiting for me. I'm sure as you have been, sleeping soundly. Stop talking. That is an order. You forget who the head doctor is in this hospital. I can have you fired and blacklisted from every medical position within 100 miles. I understand your concern for both me and my patient, but I have made it clear that no other doctor is allowed to see them. Do you understand? This patient is mine, and mine alone. I have been with them since the beginning of their stay here. I know them better than anyone will. If they get assigned to another doctor, that is the end of their life. Do you want a death on your hands, Nurse Felix? I take your silence as coming to an understanding. Go on your break. I'll take over from here. My patient needs me. Ah, you're awake. I didn't expect you to be awake at this time. Usually you're sleeping. You're staying awake for longer periods of time now. You almost have a proper schedule again. I sent your nurse to lunch, so it will just be you and I for the time being. Do you mind if I take a seat? How are you feeling? I see. I'm happy to hear that you believe there has been improvement in your health. Positive thinking has been known to be a type of medication. Are you comfortable? Do you need any more blankets, pillows? How about water or something to eat, perhaps? No? Well, if you change your mind, I'll be here going over your chart. Of course you can ask me something. I'm your doctor, after all. I'm here for whatever you need. I admit that's a silly question. Of course I have other patients. Doctors have entire rosters of patients to take care for. However, some patients take priority over others. You, my dear, are my priority. You are a special patient that needs my utmost care and attention. Now, I know that you told me that you're feeling one way, but let's see what the nurses have here. What was that? When are you going home? Oh, no, my dear. You can't possibly go home yet, or anytime soon for that matter. Why? Well, because you're still very unwell. That accident, along with the other health complications you had prior, has done quite a number on you. You may feel fine, but you are far from the fact. It's all in your head. Positive thinking, while I said can be a type of medication, is typically a placebo. It's a dangerous placebo. If I release you too early, you'll be back to where you started, if not worse. I'm sure you don't want that, do you? You must trust me. Again, I'm your doctor. I know what's best for you. I've studied this. I've studied you. There's no one better fit to take care of you than me. I'm surprised you asked that question. You make it seem like you're a prisoner here. Is being here that bad? You get to relax day in and day out. You have no worries, cares, nor responsibilities. You're completely taken care of. I've even made sure to exempt you from hospital payments. I've made sure you are comfortable and satisfied and will continue to do so. Whatever the hospital doesn't currently provide, I can make happen. For example, if you aren't happy with the food served here, I can have food delivered to you from wherever you'd like. If you want a book, a movie, or a sketchbook to pass the time, I can get it to you within the hour. Whatever your heart desires, just say the word and it's yours. As I've said, you're not just another one of my patients. You are my priority. With being my priority come special perks that you get that others won't. All you have to do is let me worry about what is wrong with you and trust me to take care of you from here on out. I haven't told you what is wrong with you specifically, no, apart from the obvious wounds you sustained from the accident. You wouldn't understand. What's happening to you is extremely complex. It's hard to explain in layman's terms. It's why you're kept here from the other patients and doctors. Only nurses that I've selected specifically are able to be a part of your treatment. Your case is very unique, and only I can understand it and treat it. You don't appear to be understanding and insist on fighting me. So here is the last thing I'm going to say on the matter. You knowing the specifics of what is happening and the treatment is not going to help you. If anything, you'll worry yourself sicker. I have profiled you as the type, and I am not going to take any risks to your health. Please, trust me. I am not going to ask you again. Stubborn one, aren't you? Here I am, giving you a life to be waited on hand and foot at my say-so. You do not have to worry nor even think about a thing. All you have to do is stay put, and let me do what I need to do to keep you here. I would apologize for misspeaking if that were what I did, but I did not. You are testing my patience. Even if you recover from what has happened to you, you will not be allowed to leave. I will not let you leave. For you to be truly safe and truly healthy from this point on, you must be kept away from a world that's crawling with corruption and disease. I know that now. It is the world outside that brought you to me, and now it is my duty to keep you here. My word is law. I can write you off as a patient who is delusional and uncooperative, so you are ignored by everyone but me. It will be your word then against mine if you decide to do something rash. I am the head doctor. There is a reason I call this hospital mine. I can make anyone's current career and future career crumble if they so much as think of tampering with you. People would turn a blind eye, my dear, so I suggest, unless you want to be restrained from here on out, and kept high and compliant off the array of drugs I have at my disposal, you keep your questions to yourself, and instead tell me what I can do to make your stay more comfortable. You appear to be overwhelmed. It's clear that you need to rest. This will pinch. Too slow, my dear. What did I do? I gave you something to help you rest. You don't have to fight me anymore. Close your eyes. I'll have you seeing things my way soon enough.